We're going to turn right now to that fight against COVID and the fast-spreading Omicron variant. Joining us this morning is the director of the CDC, Dr. Rochelle Walensky. Dr. Walensky, I want to dive right in. Thanks so much for being with us this morning. Your agency, you know this, is facing a lot of criticism over these new guidelines over isolation and not requiring a 5-day test to get out of those isolations. The American Medical Association is going as far as saying they're not only confusing, but they risk spreading this virus even further. Are they wrong?
Let me just clarify and say isolation. We talk about isolation in the context of people who've had a positive test, who know that they are infected. And we have now dozens of studies referenced on the CDC website that have demonstrated that you are most infectious in the 1 to 2 days before your symptoms and the 2 to 3 days after your symptoms. So by 5 days after your symptoms, the vast majority of your contagiousness is really behind you. And what we say at day 5 then is, are your symptoms gone? Are you feeling better? Is your cough gone? Sore throat gone? And if so, then it is safe to go out if you are wearing a mask all the time. And that means not going out to restaurants, not going out to gyms, not going in visiting grandma, but really conscientiously wearing your mask for those last 5 days. Now, some have said that they are interested in using an antigen or a home test at the end of those 5 days. And if people are interested and have access, then they may choose to take that extra step and do that antigen test. We've provided some guidance as to how to interpret that. And that means that if that test is positive, you should stay home for those extra 5 days. But if that test is negative, you should go out and continue to wear your mask. Now, I've read the AMA statement and I have deep respect for the AMA, but I will also say we've heard a lot of support for our ongoing guidance from public health partners, from other clinical and laboratory partners as well.
But as part of the consideration in not requiring a negative test after these 5 days because there aren't enough tests to go around in this country?
You know, we make these recommendations in the context of science, in the context of ongoing epidemiology, in the context of what is feasible in collaboration with our public health and local and state public health partners. And through that discussion and through the discussions within CDC with our own subject matter experts and with the FDA, we made the recommendation, you know, these tests are actually not authorized for the purpose of evaluating contagiousness.
I want to ask you about those encouraging headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with. And yes, really encouraging news in the context of Omicron. This means not only just to get your primary series, but to get your booster series. And yes, we're really encouraged by these results.
Dr. Walensky, thanks so much for your time this morning.
Thank you.
The CDC director is finally making this info transparent.
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with.
75% had 4 or more comorbidities. In 2020, we showed people this clip of Dr. Ezike, the director of Illinois' Department of Public Health.
Technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death.
And for the record, Elon Musk was trying to tell people this on Joe Rogan's podcast in 2020.
If you're ill at all, it's like it could be COVID. So just to give people better information, definitely diagnosed with COVID or had COVID-like symptoms. We're conflating those two so that it looks bigger than it is. Then if somebody dies, was COVID a primary cause of the death or not?